Hey folks, did you know that the fall annual enrollment period, this coming October 15th to December 7th, some call open enrollment, some call annual enrollment, but it's the one time you can change your prescription Part D drug plan or change from Advantage plan to Advantage plan, but it's got nothing to do with a Medicare supplement. The majority of my clients are on Medicare supplements. The folks that are on Medicare Advantage plans are folks that are on disability and under 65 and they can't afford or even get, it's not even offered, Medicare supplements. So the Plan F, the Plan G, the Plan N, if you have one of those, you don't need to change anything. These Medigap plans, they don't change their benefits each and every year like Medicare Advantage plans or drug plans. And I'm going to explain a little bit later, but there is no need to change your Medicare supplement plan because the key is this. When you first turn 65, you get a 6-month window to enroll in any Medicare supplement of your choosing. Plan N, Plan G, and with no health questions asked. Actually, in South Carolina, if you have a Blue Cross Blue Shield Medicare Advantage plan, they'll give you 36 months to get out of that with no health questions asked, but you got to go into a Blue Cross Blue Shield Medicare supplement Plan G. So anyway, after that window passes, after the 6 months is up, you have got to pass underwriting. You have to answer no to health questions. They're going to do a 3 to 5 year med check and look at all the meds you've taken. And if you've got any issues or serious issues in particular, you can't get a Medicare supplement. Medicare supplement plans, they don't change ever. You get a Plan G, you got to pay your Part B deductible, which this year is $226, probably go up next year. But the bottom line is the plan doesn't change. You just got the Part B Medicare deductible. Once you pay that, you pay nothing for the rest of the year as far as Part A and Part B costs. Say you got the Plan F. You're 75 years old. You've had the Plan F forever. You don't need to do anything this fall. The plan Medicare pays first. The Plan F pays everything. These Medicare supplements are standardized by Medicare. They offer the same identical benefits. Those benefits never change. The only reason you'll ever want to change your Medicare supplement plan is if you get a premium increase, all right? So let me give you an example, but supplemental rate increases, they don't always occur on January 1st, like an Advantage plan increase or a drug plan premium increase. It starts January 1st. With supplements, you're going to get a letter in the mail, and let me show you this. So you're going to get a letter in the mail. Let's say you took out a policy in last June of 2022, and the effective date was June 2nd. So you're going to get a letter from the insurance company right before June, right around June, saying, hey, guess what? You've got a rate increase, and if there's a big rate increase in June, you can change Medicare supplements any time of year you want, as long as you're healthy. So my point is, when you get that rate increase letter, well, in my case, many of my clients got rate decrease letters, and so that's because I usually go with the Plan N, not the Plan G. So guys, it is inevitable. I had a huge block of clients that it's partially luck, but it's partially because I do my research and I look at the rate increases for my clients each year with different carriers. I go to Medicare conferences. I understand that the Plan N is not going to have the rate increases the Plan G is, but you're going to have rate increases for these plans. They're normal. They're to be expected because Medicare is going to increase their Part B deductible next year. They're going to increase their Part A hospital deductible, which is $1,600. That'll go up. Always goes up. Give it time. So healthcare is just subject to crazy inflation. But the good news is most of you don't have your policy anniversary date that falls during the fall enrollment time between October and 15th. I sell Medicare supplement policies all year long. I change people in June or July. I have people new to Medicare on these plans. But the good news is, if you're one of my clients, you don't want to do anything if you have a Medicare supplement. But whether you're one of my clients or your prospective client, maybe down the road after you see this video, the thing is, the reason why you don't want to do it during October 15th to December 7th is there are hundreds of thousands, masses of folks that enrolled in Medicare Advantage plans way back when, and for a variety of reasons, they decided they don't like Medicare Advantage plans. They're better off going back to original Medicare to restore their original Medicare rights, like go to any doctor that accepts Medicare, have the freedom to get the kind of care you need without prior authorizations. But the problem is you got these lock-in periods. So after December 7th, you pick your Advantage plan. It's kind of like marriage. You're stuck with that. Now, you can't get a divorce between January 1st and March 31st. You can, if you're not happy with that situation, you can make a one-time change to a different Advantage plan. But otherwise, these lock-in periods require you to stay there. So your time to change, if you have a Medicare Advantage plan, you want to go into a supplement, really is October 15th to December 7th. But before you decide to switch from a Medicare Advantage plan back to original Medicare, you probably want to make sure you can apply and actually qualify for a Medicare supplement. Whether it's a Plan G, Plan N, high deductible G, doesn't matter. You don't want to get rid of your Medicare Advantage plan and go to original Medicare and then get declined for a Medicare supplement, because then you're going to owe 20% of all Part B costs, which that's insane. You have a $1,600 Part A hospital deductible. You leave the hospital for 60 days and go back. It's going to regenerate, so you got another $1,600 deductible. But oh my God, you got to pay 20% of everything with no out-of-pocket limit. And that's where Advantage plans are fantastic, is when maybe you can't afford a Medicare supplement, or you're one of my many disabled clients on Medicare. And it's nice to know you got a maximum out-of-pocket. With an Advantage plan, there's a worst-case scenario. If you get sick, a lot of these Advantage plans, you can get a max out-of-pocket of $6,700, $5,900, and that's your worst-case scenario for the year. But let's make sure that we qualify for a supplement before we enroll in a Part D standalone drug plan, which once you do that, that kicks out your Medicare Advantage plan, your Part C plan. So first, apply for the supplement, make sure it's been issued, then enroll in a Part D standalone drug plan, which will automatically kick out your Medicare Advantage plan. On January 1st of 2024, you'll have a supplement that you've been approved for with a standalone Part D drug plan. Okay, guys, so I just showed you how to go from your Advantage plan back to original Medicare. Easiest way to do that is during your fall enrollment, enroll in a Part D drug plan. It'll kick out your Advantage plan. But what do we want to do before that? We want to apply for a Medicare supplement, make sure we get that baby issued. Once we got that issued, then we apply for a Part D drug plan or enroll in a Part D drug plan. It kicks out the Advantage plan. That's how you go from an Advantage plan to original Medicare with a supplement. Now, we're also going to talk about going from one Advantage plan to a different one. These Advantage plans change like crazy every year. Maximum out-of-pocket, co-pays, networks, drug formularies. And then for my clients, people that are on Medicare supplements, don't even worry about your supplement. I put you in the right one. We've had very low rate increases over the last few years. 3% was the biggest rate increase I had. I get everybody in the Plan N, not the Plan G, and they thank me later. Okay? So let's talk about this other stuff. But before I do, I just want you to understand, with fall enrollment, Medicare is for people 65 and over, and it's also for people under 65 on disability. Okay, for people, if you guys are disabled on Medicare, you want to shop out your Advantage plan, try to find a better one. All right? And for a lot of my turning 65s, I've run into 4 or 5 people. They're turning 65 in October and November. Most of you guys are drawing Social Security. You don't need to do anything. Your Medicare card comes, you're enrolled. If you're not drawing Social Security, you got to go to the Beaufort County office or whatever state you're in. I'm licensed in 40 states. What you want to do is just go to your local Social Security office, and they can help you. You can call Social Security as well, and they can help you too. All right, now there's only 2 paths you can go down. You got original Medicare, and this is huge for some of you people new, or maybe you're 65 and a half. I want you to pay attention to this. So a lot of you guys saw the Joe Namath commercial. So Medicare Advantage plan. Just remember, when you enroll in a Medicare Advantage plan, Medicare says, all right, we're done. We're going to pass the baton on to Humana or a private insurance company. They pay, the insurance company, Medicare pays them $1,000 a month. More for people with chronic conditions or people with Medicaid, Medicare, special needs people are going to, the insurance company gets more money, okay? So what it is, Medicare Advantage, your Part A, which is your hospital, your Part B is your doctors, and your drug plan is all bundled into one plan, all right? And you also get additional benefits like dental and vision. If you look at this chart right here, with original Medicare, you go to any doctor in the country you want to go to, including the Mayo Clinic. With the Medicare Advantage, this is the two things I don't like about Advantage plans. You're going to need to use doctors in the network. And if you lived in Hilton Head Island back in 2016, you had the Humana PPO Medicare Advantage plan. It was a nightmare. Tenet Health owns all the hospital, Coastal Carolina, Hilton Head Hospital, a lot of the doctor networks. Folks had to drive all the way to Savannah to see a doctor for like 4 months because Tenet Health said, we're not taking Humana. Right in the middle of the year, your doctor can say, I'm not taking your insurance. Sorry, you need to pay 100% or you gotta go to see a different doctor. They don't have to stay with the Advantage plan. They can fire that, and the Advantage plan might say, we don't want to work with you. Happens every day. So with an HMO, you have a very restrictive network, local hospitals. With a regional PPO, you can go to a couple different states. In our area, United Healthcare has a national PPO, which is good in all 50 states. So if you're traveling, you want to use that. But again, Medicare Advantage, they pay the insurance company to manage the heck out of your care. All right, so just remember that. And what I want to show you here too is, real quick, the other thing that I don't like about Medicare Advantage plans, prior authorizations. And some good news on that, there's going to be some changes in 2024. But how many of you have Medicare Advantage plans? You needed to get something done like an outpatient surgery, MRI, CAT scan. Anything that costs money, that as of the last few years, the Advantage plan company is going to ask for a prior authorization. So your doctor says, hey, Mrs. Jones, you need knee replacement. You got to have it. The insurance company says, well, I don't know if our doctor, we want a prior authorization. We need to look at this. And they have in-house doctors at the insurance companies that may say, no, we're denying this. In fact, we want you to do physical therapy on that knee for 6 months. And then we'll think about, so the doctor that manages your care is being overruled by the insurance company. And the crazy thing is, so when they deny you care for routine medical procedures with these Advantage plans, you got to remember, appeal it. Because 80% of the time that you appeal it, it gets approved, which leads me to believe they're just denying stuff, hoping you go away. They don't make the appeal process easy. Sometimes you got to file a grievance. It gets complicated. And they're going to, for the prior authorizations, the good news is they're going from a 14-day, they're going to move it down to 7 days. 7 days is a long time if you get cancer or you got to have surgery and you're hassling with the insurance company to try to get it paid for. That doesn't happen with original Medicare. So in my 12 years, I've seen one denial. It was for a motor scooter, and the guy got an electric wheelchair instead. But with these Advantage plans, I've seen 9 prior authorizations for my disabled clients. My wife is a disability Social Security attorney, so she wins the case, gets the award letter for them. Typically, it's 24 months they have to wait till they go on Medicare, and then I help them out. But boy, the poor folks that need it the most are getting killed with these prior authorizations. Most of these people don't have computers. They're not that educated. So our team ends up trying to help them and navigate through the appeal process and the denial process. You don't deal with that. Original Medicare, you go to any doctor you want. You decide what kind of care you get. If your doctor says you need knee replacement, Medicare is going to approve it. Medicare pays first, whatever's left. They cross it over. They send the bill to the insurance company pays the rest. With a Medicare Advantage plan, you're at the mercy of a private insurance company with stockholders. Now, I'm not saying Medicare Advantage plans, I got a feeling they're going to get better because there's 8 out of 10 of the biggest Medicare Advantage companies have been sued for fraud in the last couple of years. Big problem, the Office of Inspector General, Health and Human Services is saying, wait a minute, people are dying because of these prior authorizations. So as of January 1st, they're going to cut the prior authorization down to 7 days. They're going to streamline it. You know, I have to fax stuff to doctors' offices and insurance companies. That's how they do it. So they're going to computerize it, streamline it, and get a quick answer for you. And it's going to be a more timely process. So that's good for Advantage plans. I'm waiting to see if this happens. So again, if you look over here, Part C is managed by Humana, United Healthcare, Aetna, WellCare. Medicare pays about $1,000 a month to the insurance company for their care. It's a different way to get Medicare Part A and Part B. Well, generally, you're going to have a network of doctors. HMO, stay in network. PPO, stay in network. It's expensive if you go outside the network. There are a few plans that have the same in and out of network. What's nice about Advantage plans, some of them offer you a $100 give back, so you get $100 back into your Social Security check. They pay $100 of the $164. Other nice things about them is in areas like Hilton Head, Bluffton, Savannah, we're okay. There's a lot of dentists in the network, so they'll give you maybe $1,000 for comprehensive dental. It's not a lot, but they'll give you $1,000. They'll give you a couple $100 for glasses. All right, and they give you a few extra benefits. So that's Advantage plans. 2 things I don't like about them: prior authorizations, restrictive doctor network. All right, and the other thing is, if you have a bad year with a Medicare Advantage plan, this year Medicare raised the maximum out of pocket to $8,300. What does that mean? If you have a bad year and you're in and out of the hospital, so Advantage plans, there's co-pays for everything. You go to the hospital. On average, it's $350 a day for days 1 through 5. After that, it's $0. You go out of the hospital for 60 days, so you go back, you got to pay that $350 a day all over again. Other thing with Advantage plans is cancer. If you have an Advantage plan, get a cancer plan. They're not that expensive because if you get cancer with Medicare, you pay 20%. All the Advantage plans, you pay 20% of radiation, chemo. Part B injectable drugs like Skyrizi, things like that. If you got an Advantage plan, you're going to pay 20%. And I love how agents say, oh, yeah, we cover that. Yeah, you cover 80% of it. What's 80% of 15,000, which is Skyrizi and some of these other injectables, Part B injectables. So don't like the 20% for cancer. And the other thing is with MRIs, CT scans, typically those are $300 a pop for those. Just had a guy that had 2 CT scans done that I have to email, and he's for some reason they're charging him $600 for each one, even though the copay says it's $300, so I need to call. But they can nickel and dime you. So if you have a bad year, you could pay up to $8,300 a year. Not everybody's going to have that $8,300. I've got a kind of a sneak peek at some of these plans. Most of them are like $6,700, $5,900. It ranges. You want to find an Advantage plan with the lowest maximum out of pocket. Put a lot of my clients in a Advantage plan yet last year that was only a $2,900 max out of pocket. That's not bad. You have a bad year, you spend $2,900, you're done paying for the rest of the year. The insurance company pays the rest. All right, that's not including the drugs. So the other nice thing about Advantage plans, they have the drug plan included in the Advantage plan. That's good and bad. So you're going with an Advantage plan, you know, it's a vanilla drug plan. Does it cover all your drugs? Is that the best plan for you? A lot of analysis with Advantage plans. And you need to go to medicare.gov, and I'm going to talk to you about that in a second. So Medicare supplements, private insurance companies that supplement original Medicare. So what they're going to do is with a Medigap or Medicare supplement, if you look over here, the cost of Medicare. So for 2023, you're going to pay $1,600 every time you go into the hospital. That's your hospital deductible, $1,600. You leave, go back in, And after 60 days, it's going to be another $1,600. All right. You're going to have skilled care, 0 for the 1 through 60. After that, you're going to pay 800 lifetime reserve days. All right. You're going to pay $164 for a Part B premium. Everybody's got to pay that. A lot of my Hilton Head Bluffton people pay over $560 a month because they make a lot of money. The more you make, the more you're going to pay for the Part B premium. You can appeal that. There's an IRMA appeal, and I'll send you that information for anybody who's interested. You got a Part B deductible of $226. All right. All the Medicare supplements, if you're new turning 65, everyone's got to pay that $226 deductible. But what's nice is that big 20% of everything else, most supplements pay all that. They're going to pay the hospital deductible. They're going to pay that 20%. The only thing you got to pay is a $226 deductible. But you go to a Mayo Clinic, you go to any doctor, you don't deal with prior authorizations. So Medicare supplements can be purchased year-round, guys. So if you're one of my clients and you have a supplement, we didn't have any big rate increases, don't do anything. Sit tight and wait till your anniversary date, the date that I signed you up, the effective date. That's when you get your rate change letter. Medicare, with a supplement, you're going to need a Part D drug plan. And what you can do is you can call me and my secretary will put all your drugs in and we'll find the best plan for you, okay? But Part D drug plans are included in the Medicare Advantage. All right. So for those of you that are new, all right, new to Medicare, you got 3 months before you turn 65, the month of, and 3 months after to enroll in either a Part D drug plan or a Medicare Advantage plan. Now, this is huge, or to avoid the late penalties. If you look down here, wow, this is the most important thing. If you get anything out of this, you're new to Medicare. You can buy a Medigap policy supplement. In order to do it, you got to have Part A and B. You can't have a Medicare Advantage plan. You got to have Part A and Part B. You can't have a Medicare Advantage plan and a Medicare supplement. It doesn't work. It's illegal. We can't do it. So, Medicare supplement open enrollment lasts 6 months from when you're 65 and have Part B. All right. So your Medicare enrollment, your Medicare supplement enrollment period, you might be 66 and you're leaving your group coverage and you're going to enroll in Part B. The clock starts ticking. The month you turn 65 or the month you get your Part B, you got 6 months to enroll in a Medicare supplement with no health questions asked. After that 6 months is up, you got to pass underwriting. Best time to get a Medicare supplement is when you turn 65 or enroll in Part B for the first time. You circumvent any type of underwriting. All right? So that's the most important thing is if you're turning 65, that's the time to get a Medicare supplement. All right? There's also special enrollment periods. The one I see the most is you move outside your plan area. I've had a ton of people in the last few months that are moving here. Many of them are chronically ill. They're sick. They have a HMO or a PPO. They move here and they're like, oh no, Chris, I moved outside my service area. You don't offer a Medicare Advantage plan. Oh no, what are we going to do? You're lucky. You got COPD. You got cancer. This is another special situation where you can get a Medicare supplement with no health questions asked because your Advantage plan isn't offered here. Thing is, the plan that you'll go into is the Plan G. The Plan G is the only plan that will absorb the high cost of these chronically ill people. That's why that's why agents are idiots for selling you a Plan G when they know damn well those premiums are going to go up. The Plan G premiums will be double the Plan N in 10 years, okay? Mark my words. Because these chronically ill sick people that are losing their group coverage or moving to an area where they don't have the Advantage plan there, they can automatically, it's called your guaranteed issue right. So it's a protection for people that move, lose their group coverage. There's 6 or 7 of these different situations where you can get a supplement. You can't just get any supplement. It used to be you had to go into Plan F. Now you got to go into Plan G. And the Plan G is, the gap is widening between the premiums for the N and the G. They're almost virtually the same plan. All right? So annual enrollment period. October 15th to December 7th. So any changes you make will kick in on January 1st. All right. And during that period, Advantage plan to Advantage plan, you can go from Advantage plan back to original Medicare. You can switch drug plans from one to the other. You can go from a drug plan to an Advantage plan. You name it. All right. So, also, let's say you went into an Advantage plan and you realize your doctor's not in network and it's January 1st. If you're in a Medicare Advantage plan with or without drug coverage, you can switch to another Medicare Advantage plan with or without drug coverage. You can also drop your Medicare Advantage plan and return to original Medicare. So how do you do that? I told you earlier, you enroll in a Part D drug plan, it kicks out your Advantage plan. You don't want to do that until you get approval for a Medicare supplement. All right? And what's not covered by Part A and B? So dentures, cosmetic surgery, routine exams, hearing aids, some of that stuff Advantage plans will cover. They're going to cover, a lot of them cover dentures. They'll cover dental care. So if you have a Medicare supplement, original Medicare, we could get a great dental vision and hearing plan that I bought for myself. I absolutely love it. All right, guys. So in conclusion, here's our fall open enrollment checklist for success. Annual enrollments from October 15th to December 7th. Should have already gotten that annual notice of change. That's going to tell you everything, especially with your drug plans. It's going to tell you gabapentin moved from a tier 2 to a tier 3, which means $0 to $40 possibly. You want to look out for tier 3 drugs. Those are the brand name drugs, usually with copays of $45 for a 1 month supply. I got a sneak peek at some of the drug plans that are coming out, and what you want to watch out for. Instead of the $40 copay, they're charging 25%. So you got to pay 25% of, let's say, Eliquis, which is $500 a month retail price. So instead of paying $40 after you hit your deductible, you're going to pay 25% of a $500 drug. There's a lot of bells and whistles and different moving parts, especially with Advantage plans. So with Advantage plans, you got to check your doctors. You got to make sure that, if you need to go to Savannah for some things, you got to make sure you have a regional PPO. If you go to Connecticut or New York in the summer, you don't have a lot of options. You got to go with a national PPO. All right. So the big thing is, though, the drugs, because if you make a mistake on that, it can cost you. And the formulary changes, they can take a drug that you had covered last year and take it right off the formulary. They don't cover anymore. The good news is, insulin's only $35 for a 1 month supply. 2025, there's going to be a max out of pocket of $2,000 for the drug plans. So just do your homework. Go to medicare.gov or call me. All right. And so with these Advantage plans, if you have an Advantage plan, you want to look at the premiums. Outpatient medical coverage. Is it 20% for outpatient surgery or is it $300 copay? I'd rather have a $300 copay for surgery than 20%. All right. Inpatient hospital. Most of these plans you're looking at $350, $400, $500 a day for days 1 through 4, 1 through 5. Might be $250 for days 1 through 7. You get the picture. All right. And your Part D prescription drugs, most important thing. Go to medicare.gov, click Find Plan, type in your drugs, and then submit it. It'll tell you, you can click sort by lowest cost, premium and drug costs. It's going to tell you which plan's the best. I'm licensed with most of them, but I'm not licensed with all of them. There's 30 different drug plans this year in our area. So highly recommend that. We'd be happy to help you. I have an assistant. That's all she's going to be doing. But take some initiative sometimes too. If you take one drug or you take no drugs, you don't want to get a Part D premium and not get a plan. But take the silver scripts. Get the $5.75 low premium. If you're not taking any drugs, it's the lowest premium. It's got some good coverage. All right. Check your doctors. Check your drugs. Look at your copays. I'd much rather have a copay than coinsurance. So cancer ideation, with all the Advantage plans, you pay 20%. So one of the most important things too is max out of pocket. Maximum out of pocket. So I had a guy that had cancer. He passed away a couple of years ago. Great guy in Pooler, Georgia. And he got cancer in August. And then he hit his maximum out of pocket, which back then I think was like $5,000. But and then it starts over in January. So then he had to pay another $5,000. So he paid $10,000 out of pocket over the course of a few months because he hit the last part of the year and then he got hit the first part of the year. So last year, there was a plan that I put a lot of my Advantage plan people in. It had a $2,900 maximum out of pocket. What are you doing enrolling in a plan that's got a $7,500? This year, Medicare raised the maximum out of pocket $8,300. That's in network. Out of network, you're going to pay $10,000 this year more. So my point is this: you want to look at all the things. Maximum out of pocket's got to be up there. All right. Unless you get a hospital indemnity plan that's got a cancer plan built in. If you have an Advantage plan, you're relatively healthy. Spend the $50 and get yourself some coverage to fill in the gaps of these Advantage plans. You get cancer, good chance you're going to hit the $8,300 max out of pocket this year. Why not just spend $40, $50 and have your hospital copays covered, have your cancer covered, that it covers outpatient surgeries, and not worry about big bills, okay? So these are a lot of different things we can kind of go through. But networks, doctors, you guys get the picture. So, okay, guys, in conclusion, a few reasons why you definitely want to change your Advantage plan or drug plan. You look in the new drug formulary, you look at the notice of change, and you realize a drug that you have to have is no longer on the formulary. They've taken it off the formulary, replaced it with something else. So that's the number one reason. The other reason is maybe your specialist has decided he doesn't want to take the plan, the Humana or United Healthcare, whatever it is. That could be another reason. And lastly, when you look at your summary benefits, if you notice your maximum out of pocket has gone up to $8,300, which is the Medicare max this year for Advantage plans, you might want to either call somebody like myself so we can analyze plans. I've got software. There's software right here that you could use so you can check your drugs. Instead of just the easiest way to do it, go to medicare.gov, click on Find Plans Now, type in your zip code, and the rest is pretty much self-explanatory. You're going to click on, let's say you're looking for a drug plan, and you don't get help. Next. So I already punched in the drugs, and you punch in the drugs. You're done adding the drugs, you can go and you can look at the different prices, all the plans from lowest to highest, and it's very easy. Medicare.gov. We do it for our clients, but I'm going to tell my clients, look, if you want to jump on there and do it yourself, you know your situation better than I do, and it doesn't hurt to do it yourself. It's very simple to do a drug plan, and you just type in the drugs. I do that for my clients because a lot of times they just don't want to deal with it. They don't want to go on the computer. They'd rather have me do it for them, and I have an assistant that does that. So anyway, those are the three reasons. I had a great time discussing Medicare with you. I would love you to give me a call at 843-227-6725. Email me at mayrivermedicare@gmail.com. I would love to set up a one-on-one appointment with you. We could do it by phone. If you're local, you can come by the office in Bluffton, Old Town Bluffton. But the important thing is to educate you. And I've got videos. I've got the forms you need for whatever, enrolling in Part B, leaving your group insurance. We do it all here. So would love to hear from you. You guys have a great day. Bye-bye.